in this video we are going to see about the MCQs regarding the rectus sheath and rectus abdominis muscle. Okay, so the first question is the rectus sheath is formed by the aponeurosis of which muscle? So during the formation of the rectus sheath, we can able to say the aponeurosis which forms the rectus sheath. So we will see the options. So internal oblique, external oblique and transverse abdominis. So these are the three muscles, right? So coming to the B option, internal oblique, transverse abdominis and rectus abdominis. Actually rectus abdominis does not contribute to the formation of the rectus sheath. So the option is A. The internal oblique muscle, external oblique muscle and transverse abdominis muscles aponeurosis are contributed to the formation of the rectus sheath. Coming to the second question, the arcuate line is found at the approximately what level? It's obviously L1. Okay. Which of the following statements is true regarding the rectus sheath below the arcuate line? So below the arcuate line, in the sense the rectus sheath will be formed, anterior wall is formed by all three muscles aponeurosis, whereas posterior wall does not have the aponeurosis. Instead it is directly related to the transverse fascia transversus and the peritoneum. So we will see the options. Option A, the posterior wall is formed by all three aponeurosis. Actually this is wrong. Actually anterior wall is formed by all three aponeurosis. Coming to the B option, there is no posterior wall. All aponeurosis pass anterior to the rectus sheath. So it is correct. The transverse fascia does not contribute to the sheath. Actually, transverse abdominis contributes. And the D option is the rectus abdominis is absent below the arcuate line. Actually, muscle is presented all over. The rectus sheath is absent below the arcuate line. Rectus abdominis muscle is presented. So the option is B. There is no posterior. This is the only option which is true. Okay. Coming to the fourth question, which of the following is not a content of rectus sheath? So inferior epigastric artery. Actually, it is a content. Okay. Superior mesenteric epigastric artery is also a content. We will see in the features. Okay. Thoracoabdominal nerves is a content because the nerves in the abdomen, thoracoabdominal nerves, obviously will be presented in the rectus sheath. Inferior vena cava is not a content. So the fourth question option is the D. Coming to the fifth question, the rectus abdominis muscle originates from. Normally rectus abdominis has two muscles, medial and lateral. All it origins from the pubic symphysis and pubic crust. Okay, so this is the correct option. Coming to the sixth question, the function of the rectus abdominis includes all except flexion of the trunk. Obviously, it is the main function of it. And compression of the abdominal contents. As it is presented in the anterior abdominal wall, it will do the compression of the abdominal contents. Rotation of the trunk. It's impossible to do. Stabilization of the pelvis. So this is the option. So rotation of the trunk does not done by the rectus abdominis muscle. Coming to the seventh question, the rectus abdominis muscle is supplied by which nerve? So T7 to T12. Yeah. So the option will be A. T7 to T11 thoracoabdominal nerves and subcostal nerve T12. Okay. So the option is A. Coming to 8th question. The tendinous interactions in the rectus abdominis muscle serve to. The interactions, I said tendinous interactions is presented at the 3 levels of the rectus abdominis muscle. So option A, strengthen the muscle and improve the efficiency. Option B, attach the rectus sheath to the muscle. C, allow greater rotation of the trunk. D, serves as a site for nerve entry. So option A is the correct, because attach the rectus sheath to the muscle is not done by the, it is not the function. Allow greater rotation of trunk. Rotation of trunk is not a function of the rectus abdominis muscle. So interactions will also not contribute to it. Serves as a site for the nerve entry. It is also not wrong. It is also not the correct one. See, the option A is the correct answer. The rectus abdominis muscle is primarily responsible for, as I said in the last question itself, flexion of the trunk. Okay. Coming to the 10th question, which structure is presented in the midline between the two rectus abdominis muscle? This is the line alba. So these are the MCQs regarding rectus sheath and rectus abdominis muscle. To know more about it, just I'll give the link in the description box and you can watch that video, and after watching it, just come and practice the MCQs. Thank you.